If you work in a nursing home and care for Medicare or Medicaid patients, you will have to get a COVID vaccine. It'll be a condition for federal funds. That word coming from President Biden just this afternoon.
The president continued to encourage the unvaccinated to get the shots, and he officially announced the recommendation for the booster shots. Right now, the third jab just applies to those who receive the Moderna and Pfizer shots. It will help boost defenses as the Delta variant continues to make people sick across the country. The shot should be given 8 months after the second dose. Study results are still coming in on the Johnson & Johnson vaccine.
This will boost your immune response. It will increase your protection from COVID-19. And it's the best way to protect ourselves from new variants that could arise.
Pending approval from the FDA, the booster shots could begin by September 20th. But as medical reporter Liz Bonis explains, this decision is stirring up some coronavirus controversy.
If you talk to those who've been following the research, there is still a bit of pause about this third booster for a number of reasons. Perhaps because we still need more data, many say, and because around the world there are many places right now that don't have access yet to even the first vaccine.
I think they're choosing to say, well, everybody should get an extra shot to increase our immunity, and maybe that will help. But I think that the data is limited on whether that's going to make a big difference or not.
The recommendation for the third shot came from data reviewed by the CDC. 3 separate studies showed reduced protection from infection of COVID-19 over time. A New York study between May and July found effectiveness went from 92% to 80%. A Mayo Clinic study comparing the Alpha variant and the Delta variant found with Pfizer, it dropped from 76 to 42%. With Moderna, 86 to 76%. A study published in the weekly Morbidity and Mortality Report by the CDC found nursing home residents had a drop from 75% last March to 53% in August.
Also, the complicated part to this story is, even though the antibody levels are going down, even though people are getting infected, are the boosters really going to make a difference in terms of preventing illness in people who've already been vaccinated?
Dr. Carl Fichtenbaum was one of the principal investigators for the Moderna trial at Ohio's University of Cincinnati.
We also don't know if we give this extra shot, will it prevent further transmission of infection from people who are vaccinated to others?
And then there's the ethical question. Will giving a third shot of the COVID-19 vaccine to healthy Americans help end a pandemic where variants keep coming from places where people have very little access to vaccines?
The longer that this pandemic continues in other places, the more likely that new variants will arise beyond the Delta variant and potentially cause more problems for us as this virus continues to circle around the globe.
Now, of course, the best person to talk to about the first dose, the second, or perhaps this third is your own healthcare provider. I'm medical reporter Liz Bonis. Now back to you.